Attention! This video discusses heavy topics. SA, homophobia, and other forms of LGBTQ discrimination are covered. Viewer discretion is advised. Also, this video covers a very specific instance of a group's harmful practices. However, it is important to note that not all in the group hold these harmful beliefs. So about 2 weekends ago, I went to Boston and had a good time with my family. I had also went to Framingham Pride a couple of months ago, and I got some Pride merch that I have been using quite a lot ever since. And especially given how welcoming Boston is and how I know queer visibility matters, it was a no-brainer when it came to what I wanted to wear that day. Overall, I didn't have any issues with my family or within the common areas regarding my attire. However, an instance later that day was at the very least questionable. We were on the common when someone was preaching and gave me and my mother some pamphlets. I didn't think much of it in that moment, but I eventually came about reading it, and what I saw was both shocking and disappointing. The pamphlet, uninvited, didn't seem to provide any context whatsoever. Uninvited from what, one may ask? I opened it out of curiosity. The first couple of pages depict patients in a hospital with IV poles talking about their bouts of insomnia and struggles with pain. Only later in a comic-esque pamphlet did it become clear what the topic being discussed was. The patients depicted in the comments were living with AIDS, and the nurse depicted in the comic does not like the idea that they are gay. She claims that they are evil, filled with demons, and they are in the hospital because they are gay. I found the depiction not only to be harmful and hurtful, but also dangerous. She then proceeds to tell her patients about how she was abused as a child and was left to die, but she found a nearby church where she was saved. Otherwise, she could have turned lesbian. The patients then proceed to share that they were also abused when they were younger. While this is ultimately a piece of religious propaganda, it also spreads misinformation about HIV and AIDS and about what it means to be LGBTQ. HIV is a bloodborne pathogen that can be contracted through sexual contact, IV drug use, through parent to child during childbirth and nursing, as well as accidental needle sticks with contaminated sharps in high-risk settings, such as hospitals. When left undiagnosed and untreated, it can become AIDS. HIV is a retrovirus. Essentially, when first infected, the virus tricks the immune system into thinking that it is not an enemy. Therefore, the virus is left in the system, replicating and causing havoc in the body. After hacking the immune system, the body is left vulnerable to infections. Even a cold can wipe out a person with HIV who is not receiving proper medical care. And the truth of the matter is that the virus does not discriminate. All sexual orientations, ages, and genders can be infected with HIV. The myth that AIDS is a gay disease harms many. However, unlike the jab that the comic tried to make, science did come very far. Pre-ep and PEP can drastically improve outcomes for people who are HIV positive, as well as preventing potential HIV infections in high-risk individuals who may have been exposed to the virus. Many people with HIV who seek treatment and care live on to experience rich, fulfilling lives and create positive impacts in their community. One example being the singer Billy Porter, an icon living his best life and shining for all to see. People with HIV do not need to be in a hospital like in the comics. When tested and treated, they can live wonderful lives, with some medical visits to make sure that the condition is properly managed. Now, I would like to go back to the comic to debunk some of the anti-LGBTQ+ beliefs being espoused. Being LGBTQ is not a choice. You are born LGBTQ. The only reason it seems like a choice is because unlike being straight, cisgender, and allosexual, being LGBTQ+ often involves coming out, a process where, when an LGBTQ+ person feels safe, they will tell someone who they love, what pronouns they use, and what love may mean to them. They may also not express love in certain ways, or not experience romantic feelings at all. That is also okay and normal. Some LGBTQ plus individuals may be exposed to sojichi, commonly known as conversion therapy. It is a harmful practice that attempts to change them in a way that conforms to cisgender, heterosexual, and allosexual societal norms. As mentioned, since you are born with the sexual orientation and gender identity you have, you cannot change it, no matter how hard you try. Sojichi is harmful because it tries to tell you that you are wrong, just like the comic attempts to portray being gay as something the patients could have fixed. Also, SA and being LGBTQ are not necessarily related. The abuse the abuse does not make someone LGBTQ but LGBTQ people are more likely to be abused, especially because of discrimination and hate targeted at them. Anyone can experience abuse in their lives, regardless of sexual orientation or gender identity. There are places that can help people explore the abuse, including places specialized in LGBTQ survivors. However, equating SA to being LGBTQ is a cruel and ignorant thing to do. It may have been a simple comic, but it made me think a lot. Perhaps not in the way that the publisher intended. It made me think about how misinformation spreads and how to combat it. Fear and a lack of understanding does numbers. However, I believe love and knowledge are powerful vectors when it comes to fighting false information. When people feel safe to talk about their fears and can better understand how the world works and what someone they know may be experiencing, not only do they now have understanding and tools to help others, but they can call out false information when they see it. And that is an effort that I would be proud to be a part of.